First aid is the emergency care and treatment of a sick or injured person before professional medical services are obtained. First aid measures are not meant to replace proper medical diagnosis and treatment, but will only consist of providing temporary support until professional medical assistance is available. This session provides instructions for CPR and choking rescue procedures that follow the Red Cross, U.S. government, other medical manuals, and the American Heart Association guidelines. Even so, this is not a certified CPR program. We highly recommend that you enroll in a certified CPR program. Being certified in CPR will increase your value to your company and will be useful for the rest of your life. ABCs of CPR. The final two first aid techniques you should know are CPR and the Heimlich maneuver, both of which concern breathing and the heart. Before we start, it is important that you understand what keeps us alive. In order of importance, they are the airway, breathing, and circulation of the blood. Seconds after being deprived of oxygen, the heart is at risk of developing irregular beats or stopping. When the heart stops within 4 to 6 minutes, the brain becomes subject to irreversible damage. Atmospheric air essential for life contains approximately 21% oxygen. When you breathe in, inhale, the blood in the lungs takes only a quarter of the air. The air that you exhale contains approximately 16% oxygen. This is enough to support life. This fact will be relevant to the overview we will cover regarding administering CPR. But there are a few other issues we need to go over first, and they are the ABCs of maintaining life support. Let's look at them one at a time. A. Airway. B. Breathing. C. Circulation. Airway obstruction, also known as choking, occurs when the airway becomes blocked. The airway is the route for the passage of air into and out of the lungs. The restoration of breathing takes precedence over all other measures. The reason for this is simple. If a person cannot breathe, they cannot live. Individuals who are choking may stop breathing and become unconscious. The universally recognized distress signal for choking is when a person starts clutching at his or her throat with one or both hands. If they can speak or cough forcefully, encourage them to cough until the object is dislodged. If you hear a high-pitched wheezing, or they cannot breathe, it's time to use the Heimlich maneuver. The most common causes of airway obstruction are swallowing large pieces of improperly chewed food, drinking alcohol before or during meals, and laughing while eating. The tongue is the most common cause of obstruction in the casualty who is unconscious. A foreign body can cause a partial or complete airway obstruction. One way to assist a casualty who is choking is to use the Heimlich maneuver. Dr. Heimlich invented this procedure, which is now known as the Heimlich maneuver and has saved many thousands of lives. Suppose you are on your post around lunchtime and you see someone grabbing at their throat and pointing to their throat. This is a natural reaction, and almost always is the same for someone in distress that is choking on something. You have to act fast. Seconds count. The first thing you should do is shout out for someone to call 911. Then quickly but methodically position yourself behind the person. Wrap your arms around their waist. Place one of your feet between his or her legs like this, so you can support their body if they lose consciousness. Make a fist with one hand. Place the thumb side of your fist against the person's abdomen here, just above the navel, but well below the sternum or breastbone. Grasp your fist with the other hand and in a quick upward thrust into the abdomen, like this. Thrust, thrust, thrust. This may cause the object to pop out. Repeat thrusts until the object pops out or the person loses consciousness. If the person loses consciousness, gently lower him or her to the ground. Call out if someone has called 911, or if you are alone, you make the call on your radio or cell phone. You now have a major life-threatening situation and need to initiate breathing as soon as possible. The longer the casualty is not breathing, the more serious the situation becomes. Finger sweep. If the Heimlich maneuver failed and the person is unconscious, try to dislodge the object with a finger sweep. If you don't get the object out, the person may die. But be careful not to push the object further into the throat. If you see the obstructing object, try to remove it with a sweeping, hooking motion with your index finger. Be careful not to push the object further in. Remember that when you give the Heimlich maneuver to a child, you should use much less force. With an infant, you should hold them face down on your arm with the head lower than the body and pat the center of their back with the palm of your hand. Do not pat too hard, or you will cause internal problems. Also, when you pick up a baby, hold his head with your hand so that the neck does not bend and cause another problem. Once the object is dislodged, the victim may need CPR. CPR. This portion of the training video is based on the American Heart Association guidelines developed for CPR training. CPR bides time until help arrives. A word of caution. Practice CPR rescue skills only on a mannequin, never on a live person. If you are practicing CPR on a mannequin and using this video as your instructional guide, be aware that some of these activities are strenuous and may cause shortness of breath. If you experience shortness of breath, pause the video and rest. If you experience chest pain, stop and call your doctor. CPR is easy to learn, as easy as ABC. Once you learn the basics and practice, CPR can become second nature. In this session, you will learn how to tell if someone has stopped breathing or their heart has stopped and what to do. That's what CPR is all about, buying time until help arrives. Buying time requires essential rescue techniques. Techniques are slightly different for adults, children, and infants. We divided this session into 3 age group categories. Adults, anyone over 8 years of age. Children, anyone from 1 year to 8 years of age. Infant, anyone under 1 year of age. Again, remember, always practice on a mannequin. CPR skills may help you to save a life. And take it from me, there is no better feeling than saving a life, and no worse feeling than standing there helpless. Let's get started. We are going to use the adult CPR mannequin to demonstrate the various techniques. We will also demonstrate the infant mannequin a little later. First, we are going to take you through the rescue techniques for an unconscious adult whose breathing and heart has stopped. Then we will put those skills together in a real-life situation. Again, these rescue skills are as easy as ABC to remember. A. Open the airway. If the head is not in the right position, a person cannot breathe. To open the airway, be sure the person is on their back, facing up. Place one hand on the person's forehead and place 2 fingers of your other hand under the bony part of their chin. Lift the chin upward and tilt the head back like this. This opens the airway. B is for breathing. Take 5 seconds to check if the person is breathing. Look, listen, and feel. Turn your head so that you are facing the person's chest as you lower and place your ear close to the victim's mouth to hear and feel the air from their breath on your face. If there is no air, it is imperative that you get air into the victim immediately. Next is C, circulation. Check for pulse by using 2 fingers. Find the Adam's apple and slide your fingers into the groove on the side of the neck. Feel for 5 to 10 seconds. Right here. If you can't find a pulse, you need to give the victim chest compressions right away. Use 2 hands in the center of the chest, right here, to compress the heart to start blood circulating. Here's the best way to find the hand position. Follow the bottom of the rib cage up to the notch where the ribs come together. Measure 2 finger widths up from the notch and place the heel of one hand here, like this, over the sternum. Interlock the fingers of your other hand like this. Be sure to press with the heel of your hand. Straighten and lock your elbows and position your shoulders directly over the body and use your weight to compress the chest 1/3 to 1/2 of its depth. If you are using a CPR mannequin, set the control to adult. The mannequin will make a clicking sound to let you know you are doing it correctly. 1 and 2 and 3 and 4 and 5 and 6 and 7. This is the essential skills you will need for an unconscious adult whose breathing and heart has stopped. Now let's put them together in a simulated real-life situation. You're on your post, and you find someone that appears to be unconscious. The first thing you should do is try to wake them. Shake them and shout, "Are you okay?" Quickly listen and feel for breathing and check for a pulse. If they don't respond, have no pulse, or have stopped breathing, shout for help. If no one responds, give CPR for about a minute before you call 911. If you have a radio or cell phone, use it to notify your dispatcher and 911. Remember, every second counts. Help! Call 911. I have someone who can't breathe and their heart stopped. This is post 410. I have an unconscious person in the rear 2121 P Street Northwest. Adult choking and unconscious. Let's look at another situation. You find someone unconscious. You shake them and ask them if they are okay. Call 911. Breathing. Check for breathing. Look, listen, and feel for breathing for 5 seconds. See if the chest rises. If the chest does not rise, retilt the head and lift the chin to make sure the airways are open. Here's how you can clear the airway and continue with your ABCs. This is a variation of the Heimlich maneuver we already went over, only this time the victim is already down and unconscious. Straddle the thighs facing the head. Place the heel of one hand on the stomach, slightly above the navel, but below the notch in the center of the chest. Interlock your hands as we showed you earlier, interlocking the fingers of both hands. Lock your elbows and use the weight of your body and the heel of your hand to give 5 quick thrusts inward and upward into the stomach. Thrust, 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 thrust. After 5 thrusts, move back over to the side of the victim and open the mouth. Place your thumb on the tongue and grasp the jaw like this, lifting the chin as you do it. Look into the mouth for any obstructions. Use your hooked index finger to sweep anything out of the mouth. Be careful not to push it in deeper. And remember, any time the breathing resumes, turn them on their side to recover. CPR for a child. Children 1 through 8, the CPR process is basically the same with the following exceptions. Use one hand only when you do chest compressions. Use the other hand to keep the head tilted. Lock your arm, moving directly over the child. Use your weight to press 1/3 to 1/2 the depth of the chest. If you are using a mannequin, set the pressure control to child. Shake the child gently and ask if they are okay. Are you okay? If the child is not breathing, tilt the head, pinch the nose, and give 2 breath and blow. 1 and 2 and 3 and 4 and 5. Tilt head, lift chin, pinch nose, and blow. 1 and 2 and 3 and 4 and 5. Tilt head, lift chin, pinch nose, and blow. Continue until the child's breath resumes or until help arrives. Stop and check the pulse every few minutes. If the breathing resumes, turn the child on his side so he can recover. Infant CPR. Sometimes babies under 1 year of age can choke on something and stop breathing, which will cause the heart to stop. It is crucial to start rescue efforts first before you call 911. To open the airway, place one hand on the baby's forehead and one finger under the baby's chin. Lift the chin upward and tilt the head back. Take 5 seconds to see if the baby is breathing. Look to see if the chest rises or you hear or feel their breath. To check the pulse of a baby, take 2 fingers and place them on the inside of the baby's arm between the elbow and the shoulder. Feel for 5 to 10 seconds right here. If you cannot find a pulse, you use 2 fingers to apply chest compressions. The best way to find the right spot is to measure 1 finger width down from the nipple line in the center of the baby's chest. Place 2 fingers there and compress the baby's chest by pressing 1/3 to 1/2 the depth. Use the other hand to tilt the head back. Compress 5 times. Tilt head. Find the finger position. 1 and 2 and 3 and 4 and 5. Continue giving 5 chest compressions and 1 gentle breath until the baby recovers or until help arrives. Baby conscious and choking. If the baby is conscious and its cry is weaker than normal and is gasping for air, that means the baby is choking. The airway is obstructed, and you must clear it. You cannot use the Heimlich maneuver on a baby. Here is what you can do. Pick up the baby and lay it face down across your forearm with the head lower than the body. Always support the baby's head and neck with one hand. Use the heel of the other hand to give 5 blows between the shoulder blades like this. These blows should be firm, but not so firm that they would injure the baby. After the 5 blows, turn the baby back over. Make sure you are holding the head and neck and have a firm grip. The head should be face up, but still lower than the body. Find the spot below in the middle of the chest, just below the nipple line, and using 2 fingers give 5 thrusts. 1 and 2 and 3 and 4 and 5. If the object doesn't come out, lay the baby down and tilt the head and open the mouth, and try to hook the object out with your finger in a sweeping motion. Try not to push the object down further. If at any time the breathing resumes, lay the baby on its side to recover. No matter what age segment you learned, those are the essential skills you'll need to help save a life. Remember, some action is better than none. And once again, practice with a mannequin and become certified in CPR. We have gone over the basics in first aid, and now you need to practice to become more proficient.